This is the extract of pig brains.
Wow. Okay. Well, so what do you do with pig brain extract?
Well, you inject yourself with it.
Wow. Okay.
It sounds crazy, but
It sounds very crazy.
I mean, why not?
What got you interested in science, nootropics, becoming a self-taught scientist?
I got involved in nootropics about 15 years ago and biohacking. I've had my DNA mapped. I use this service called Self-Decode, and it turns out I have some of the worst genes in the world. So these bioregulators, the vast majority of the research was done in Russia by a doctor named Professor Vladimir Kovinson, was actually Vladimir Putin's longevity doctor.
He looks easily 50 to 60.
I'm interested in what they call N of 1 studies. N of 1 is one person's experience. This is enough for me to experiment with it myself. And so what I can tell you, I've taken a lot of things and I don't feel jack squat. But this one, I feel it.
And what do you feel?
You just start to feel this really potent head feeling. More focus, more calm, more clarity. This one works, and a lot of people consider this their favorite nootropic.
Hi, everyone, and welcome to Pilled. I am your host, Ryan Bethencourt, and delighted to have you here on the show today. We're having Marshall, who's going to talk to us about Nootropics DAO and his entire journey. Just as a quick reminder, this is never medical or financial advice. We're here for edutainment, to learn, to grow together on the frontier of DSci. All right, Marshall, welcome to the show.
Thank you.
Would love
that
to
was a
hear a
great
little bit more
opener.
about your unique background, right? So, you know, we've talked a little bit before the show, and would love to hear a little bit more about you. Like, what got you interested in science, nootropics, becoming a self-taught scientist? Because I know that's been part of your journey. And so we'd love to hear a little bit more about you first before we dive into Nootropics DAO.
Yeah, well, I didn't expect to be talking about this, but I can. What got me into this whole health journey was my dad passed away of a heart attack when I was 17.
Oh, wow.
And so I just started learning all I could about health so that I could avoid a similar fate.
Mm-hmm.
And I've had my DNA mapped. I use this service called Self-Decode. I don't know if you're familiar, but
No.
turns out, selfdecode.com, and it turns out I have some of the worst genes in the world. I mean,
For cardiovascular disease or?
all kinds of things, man. It's like cancers, like cardiovascular, Alzheimer's, like all kinds of things.
Oh, wow. And by the way, cardiovascular disease is, I believe it is the number one killer now in the West. Like it's like I thought it was below, cancer and things like that, but no, it's actually, and my grandfather got taken out by heart attack, and he was a doctor, and my father had 2 stents. So I understand where you're coming from. I'm always like, oof, my heart might get me first,
Right. I would be lucky if my heart gets me first. Compared to some of those other fates.
Yeah. So kind of learning about yourself, right? The journey of me, and which started with the journey of your father. And of course, very sorry to hear that he passed. I know that cannot be easy for a 17-year-old. So that gave you this passion to like understand yourself, us, and how to change the outcome, right?
Yeah. And so I started reading the journals about that time, and I was reading about fish oil, which back then nobody had even heard of it. Now it's totally mainstream. They sell it at Walgreens and Costco.
And it's an approved therapeutic drug, right? Like that's one of the craziest things, that you can actually get prescription fish oil. I always found it truly bizarre, but it's a drug now as well.
Yeah, well, they have all kinds of prescription normal stuff. Like you can get prescription melatonin in Europe. So, whatever the drug companies can make a buck off of, they will. So, but anyways, yeah, I mean, I learned about fish oil like long before anyone had even heard of it. And, that was like 20 something years ago. And so, which I ended up, I was doing like SEO at the time professionally.
And for those that are not familiar with search engine optimization, right? So it's basically how things get ranked in Google. It's an art and a science, right?
Yeah. So I had a background in that. And, but I wanted to see how I could do starting from scratch. And so I created a website devoted to fish oil. And within a year, I was on page 1 whenever you search for fish oil. And then within like 2 or 3 years, I was number 2 on Google.
Wow.
For fish oil, right below Wikipedia. I could never beat them. And that just kind of gives you a sense of my background in terms of like how I came to be in charge of growth for the DAO. But
which makes a ton of sense. I mean, growth, I think it's one of the least appreciated aspects of starting a science business or science DAO. It's how do you actually turn ideas into revenue, ideas to products to revenue. Many of the scientists that we've talked to on Pilled, some of them have gone down that journey and have become excellent at it. Like we had a whole commercialization episode with ZBiotics, OneSkin, and HairDAO on their journey. But a lot of scientists really struggle with that because it's not something that they're comfortable with. How I have to sell a product. How do I do that? Well, shouldn't the data speak for itself? No, it never does, right? The data by itself is not enough to convince people.
Right. And that's a great point about what kinds of content or information or knowledge different kinds of people consume or find accessible. And so I'm kind of getting ahead of myself here. I think we can get to sort of like the kinds of things that we're doing.
Mm-hmm.
Growth activities.
And just to connect that, Marshall. So you got really interested in peptides. You kind of came back, learned about peptides, and then how did you come across like Nootropics DAO? Like how did you get involved in Nootropics DAO?
Yeah, that's a great question. Because I got involved in nootropics about 15 years ago and biohacking. And eventually I just left the entire field because it was a bunch of snake oil and BS and none of that stuff worked. And so I just disappeared for the next 10 years and did other things. But just in the last few years, I got a lot more interested in peptides. And I think what really put peptides on the map was the popularity of GLP-1s. Ozempic or Mounjaro. And these are peptides. But they're sort of like gateway peptides. And so it's like once you get into the GLP-1s, then you start finding out about the growth hormone releasing peptides and the BPC 157s and GHKCUs and all those other peptides.
And just to give people context, Marshall, like these peptides are pretty wild, right? Like some of them, like the BPC 157 plus the other peptide is called the Wolverine stack, which is kind of,
TB 500, right?
Yeah, GP. So there's like these really interesting combinations of stacks for personal healing, for various other things that actually seem to work, even though they are, and this is really important, they're not approved by the FDA.
Right. The FDA is big mad about them.
Mm-hmm. Exactly.
Yeah, they've basically, they're trying to, they're compounding pharmacies have been producing these peptides, and the FDA is shutting them down. So it's kind of interesting. There's like a war on peptides, which is changing with this new administration.
It appears so, right? That appears to be the case, that the war on peptides appears to be abating.
We'll see how far it goes. Right now, they're just handing out cheap GLP-1s. I don't know if you saw that.
I think was it like $100 or something? Like Trump wants to give everyone cheap GLP, right? GLP-1.
This is just in like the last couple days or something.
I saw something about it. It was like $100 or $200,
Yeah,
something like that, where everyone can have as much
vary.
GLP as they want for a good price.
Yeah, the price is going to vary, and it's probably going to be different for semaglutide versus tirzepatide.
Yeah.
But you still can get retatrutide, which is the best one.
Yeah, that's that, and that one's still, and that's because that one's still in research. So that one is still not approved. Just for everyone that's listening, and Marshall, that particular retatrutide, I've seen a lot of the influencers talking about it. They've said how exceptional it is. Why is it so different?
Well, so that one is known as a triple hormone agonist, or receptor agonist. So semaglutide, it targets the GLP-1 receptor. Tirzepatide is a dual hormone agonist. It targets GLP-1 and GIP. Retatrutide targets a third. So it does three. And the third one is glucagon. And what's interesting about glucagon is it increases your resting energy expenditure. So basically, you're just burning more calories just sitting there, doing nothing. But that's not just why it's so effective. It's effective because it's also really finely tuned, finely balanced in a certain way. Because what that one allows you to do that the other ones don't is eat. The other ones, if you eat a normal human amount of food, you're going to feel really full or sick or nauseous, but this one takes the foot off of the gas with GLP-1. And in fact, GLP-1 is the last one that it targets. It goes GIP first, and then it hits glucagon receptors, and then it hits GLP-1 last. So this particular balance allows you to eat, whereas the others don't. And so you end up having less weight loss coming from lean body mass or muscle mass.
Fascinating. So yeah, you keep more of your muscle, which is one of the big issues with GLP-1s. People lose muscle mass during it, which I think they also do during fasting too, right? Like I think during fasting you also lose muscle mass.
Uh-huh.
Hmm. Yeah.
Yeah, so this one's it does make eating feel optional.
Fascinating. Really
so
fascinating.
You have to learn how to regulate yourself without the usual hunger cues. And you really have to prioritize protein. Because if you don't, that's another reason why people lose muscle mass. They don't eat enough protein while they're doing these things.
Yeah.
But
so very interesting.
So
yeah. And so you kind of came across, and then the kind of interaction point for you and the Nootropics DAO, where was that? How did that happen?
I don't even see, they found me because I was running a Discord server devoted to research, and I was publishing these research reports about all kinds of compounds. And I was publishing reports on studies and individual studies, as well as like high level overviews of different compounds or peptides or nootropics. And they approached me and said, like, we love these reports that you're making, and we'd like you to join our council. So I joined the council early this year, and for the Nexus, which is the basically we're building the world's largest knowledge base of cognitive enhancement research.
Super interesting.
So so I joined the council, and then several months later, they asked me to join as head of growth and community.
Amazing. And so when you joined the council in the Nexus, I know you mentioned before that you're building the world's largest curated knowledge of cognitive enhancements, right? And you're creating an assembly line for a variety of knowledge artifacts. What is that? What are the knowledge artifacts?
Okay. So yeah, that's the knowledge factory.
Okay.
That I mentioned, and that's one of the unique things that this DAO is bringing to the table. And it's kind of what it sounds like, and it's an assembly line. And we are having chats. We're building a platform, which is another value that we are bringing to this community. We are building a platform, which I can show off. Actually, I've got some screenshots and whatnot.
Awesome. Yep.
But so on this platform, we're having conversations, chats about various topics, just like you would on Discord. Mm-hmm. But these are very focused chats with people that have particular expertise in various domains. So we're having these chats, and like the chats themselves, we're planning to publish the chats themselves as quote unquote content. Now, which is weird, right? Because who the hell publishes chats as content? I mean, never even heard of it. But the cool thing is we have such high value, like interesting chats, that the chat itself is a valuable piece of content. It's like you get to look over people's shoulders while they're discussing fascinating things and working out problems and asking each other questions.
Yep.
And so that's an example of like one thing I call a knowledge artifact.
And Marshall, I would add, like, this makes me think a lot about the conversations that people actually quote from the cypherpunk, forums, where Satoshi Nakamoto was having a conversation with Zuko about, zero knowledge proofs, or like these are, I think, the equivalent of knowledge artifacts from those forums. So, and they're fascinating, right? For those of you that have not looked these things up, it's like amazing. But I'm sure at the time they were just arguing, debating, apparently they used to get into so many arguments that they had to separate pure cryptographic arguments from political arguments, and so they had to make two separate forums because the cypherpunks were arguing politics in the crypto in the cryptography forum. So, like, it's really interesting to call them knowledge artifacts, right? As like something that we might look back to where there maybe was a breakthrough through one of your conversations or one of the DAO members' conversations with each other around nootropics and deeper insights that really interesting.
Yeah, you're essentially talking about archaeology.
Mm-hmm.
And Yeah, this can certainly function that way. Um, but I'm just thinking of an artifact as just like a thing. It's like its own standalone thing that is, it's sort of like people in cultural studies, they look at aspects of culture and they look at what they call cultural artifacts, when they're studying a
Marshall,
culture.
I love it. I personally love it. I'm a big fan of cultural artifacts and the fact that we create culture as we go along. Like one of my favorite types of art today, crypto art, is called avant-garde art, right? So it's this new area of art. Sometimes people call it rugcore. So it's basically like this art that looks so messy, so internet native. It's just mess on the screen, but it means something. But you have to kind of understand all of this language that comes from like a hyper internetization of culture. And you have to be native to that to actually understand what the art means. Otherwise, it just looks like graphical noise, right? And so I think that these are all knowledge artifacts. And to me, I think about your knowledge artifacts and I think like, imagine in 10 years time or in 20 years time, people will look back at that and say, this was the discussion that led to this entire chain of new peptides, new products, new things, new thinking, right?
Well, that actually is exactly what's happening. So, as I said, we have these chats, and the chat is like, it's a cultural artifact, but the chat is also the seed of knowledge. And so we have these chats, and then what we're doing with these chats is we're taking them and we're like, okay, let's use AI to create a high-level summary of all the main points that are made in this chat. Okay, and then we have this hierarchical outline of all the key points. And then we're like, okay, well let's and so that becomes its own artifact. And then it's like, okay, now let's actually have a human write an article based on a narrative. Let's tell a story. Let's tell a story about this. And that becomes its own artifact. And then we take that narrative and then we're like, well, let's record a podcast episode where we're talking about this. Where we're sort of just talking about everything we're covering in the narrative, and that becomes its own artifact. And so as we go, we are coming up with all of these different types of artifacts that are all based on the same seed of knowledge, which is the chat. The chat artifact is spinning off all these other knowledge artifacts, but it's all sort of like sourced from the same content, the same original chat. It's all the same kind of topics and ideas, but it's just looked at from a totally different angle through different lenses, because everybody has different degrees of expertise and everybody has different ways that they like to consume information. And so we're basically trying to reach people at, some are very advanced, and some need a little bit of more hand holding. They need it to be told as a story. We like that. It's kind of like Neil deGrasse Tyson or Carl Sagan is really the archetypal guy that we're going for. That that the kind of guy that can tell it that it's not just data, like you said, right? The scientists are just like, here's the data, and it's like, no, we want this to be anything but dry and boring.
Yeah,
we want to make cognitive
data
science
doesn't connect with most people, right? That's one of the big challenges to get to spread ideas. It has to be told in a way in which most people can receive ideas. And not everyone is a scientist. Not everyone loves to dive deep into a table full of numbers. right? Like that's just not going to connect with most people. But
Right.
they will listen to a story about something that makes you smarter, stronger, live longer, right? And why that story is what it is.
Right. So we want to make it cool, interesting, sexy, romantic, even, kind of like mystical, even. Like Sagan was really well known for making space seem spiritual. And
I still have that feeling, by the way. I grew up watching and reading Sagan, and so that has stayed with me. That mystical aspect of, we don't need superstition. The universe is strange enough and interesting enough on its own that I feel mystical thinking about the vast expanses of space. Like that is enough.
I
like,
just got goosebumps, man.
Right?
You were channeling Sagan.
It's mystical. Like the fact that we're hurtling on a rock in a void to who knows where from who knows where, right? Like it's like,
yeah, it is. It's very mysterious. And I mean, but I also, we have to walk a fine line between like respecting the sort of mystical nature of existence without falling into like new age woo kind of thinking. Because at the end of the day, we're all about science. We're all about, we are facilitating scientific research. That's the whole point of DSci. We're conducting our own research, and it's not like we're not content to just talk about, well, this works because of quantum, physics, right?
Yeah, we're in a search for truth. However that truth may arrive, even if we don't like the truth, that's okay. If we find truth and it's not the truth we want, well, it's better to get to truth, right? Whatever that maybe this molecule that you love doesn't work. Okay. At least we know that that's truth. So kind of to link in, because I know there's a lot of really interesting stuff happening with the Nootropics DAO team and a lot of projects. I know that there are 2 projects that have moved into mouse models, right? Into mice. And I know that Pinealon and Epitalon, I probably mispronounced it. I always do. Was that correctly pronounced? Did I correctly pronounce it?
Nobody knows, man. I mean,
okay, nobody knows. Okay. So,
yeah,
and by the way, I know you have insights about peptides, which I think will be mind blowing for people as well, like where they come from, where the data comes from, all of that sort of stuff. But why don't you give us an overview of like the 2 molecules that are currently in mice right now? What are you seeing? What are you expecting to see? What's happening there?
Yeah, well, right now, one of them is, some people say Pinealon, some people say Pinealon. What's interesting about that peptide is you'll hear some influencers call it the pineal gland peptide. And it's an understandable mistake considering it's literally spelled like pineal on.
Yeah.
But it is not the pineal gland regulator. So anybody who says that, any influencer, just go ahead and click unsubscribe because they're grifting.
Yeah, they don't know what they're talking about.
They don't know what they're talking about. But so, and I am in the habit of calling it Pinealon, but people often call it Pinealon, and it's probably better that way because it's going to be harder to make that mistake for people, to the association. And it's hard to actually explain what that one does because it does so many different things. It's part of a class or group of peptides called bioregulators. And these are not very well known. People know about the Wolverine stack. They don't know about Valon or Vylon, which is a far more effective healing peptide. And so people these things are not well known. They haven't been popularized. And so so these bioregulators, the vast majority of the research was done in Russia by a doctor named Professor Vladimir Kovinson. Kovinson was actually Vladimir Putin's longevity doctor.
Wild.
And that guy just doesn't seem to be going anywhere. People have been predicting his death for years.
Like an iron grip. What is he? He's like 80 or something. Like
and he looks great.
He looks easily 50 to 60. Mm-hmm.
And part of that is probably Botox and all that, but but part of it is, this guy's on like the best peptide technology there is. So this Dr. Kovinson was doing research going back to the Soviet Union, and he discovered these peptides that were very fundamental in the body. They were fundamental to they're found in all the organ systems. And he, for a while, they were actually making peptide organ extracts, which you can still get. And then he and his team were able to isolate particular peptides and then synthesize those. So Pinealon is one, and Epitalon or Epitalon, depending on who you ask, is another. And those are the two that we have right now currently being tested on mice. One for cognitive performance, one for longevity, respectively.
And tell us for longevity. So for Epitalion, tell us what you think it might be able to do in mice and in us.
Well, when they gave that one to elderly people with advanced age. Okay, so these people were aging faster than their biological age. Or sorry, their biological age was outpacing their chronological age. Okay, when they gave this peptide to people who were like, I think it was like 12 years biological age, 12 years greater than their chronological age. Within like a few months, or maybe within like a month or something, they were able to completely reverse the advanced age. Like they were the elderly people with advanced age were now at a normal, healthy biological age that matched their chronological age. And that change held for like 6 months at least. And so, because one of the things it does is it protects telomeres. It stimulates telomerase,
which is
and
super
increases
powerful.
Telomere length.
Yeah, which is super powerful. Like for those of us that love longevity and love longevity science, that is one of several hypothesized reasons why we age, which is the shortening of the length of the telomeres, which are the end caps at the end of your chromosome. So it's not 100% hard science. There's still variations there, but it's definitely one area of active research that seems very promising.
Yeah. And so, I mean, but this not only does that, it's involved in repairing DNA, repairing cells, has antioxidant properties, so it scavenges free radicals. It regulates melatonin. People use it as a sleep peptide. Because this is the actual pineal gland peptide. So it's hard to say, like, what you can't really say any of these peptides do, the bioregulators. You can't really say that they do one particular thing. It's like they do so many different things. And the other one, like Pinealon, also has a wide range of activities, including like, physical health, like endurance. It enhances exercise endurance. But it also, they're using it to treat cognitive decline, traumatic brain injury, stroke, and so on. So, yeah, like these peptides do so many different things.
Amazing. And so, as we're kind of exploring this, and so hopefully in the next couple of weeks, some of that data should be coming out, right? The mouse data should be coming out. Do you have a date yet when you're expecting the mouse data?
No, I'm not personally familiar with the dates on that.
I know that's been moving around because I know Pump Science, it's doing its best, but because it's doing so much new things constantly, the dates are shifting around. But typically it's a couple of weeks out. I've noticed some of the mouse data is starting to come in, and so that's cool. Really interesting.
Yeah, we are, because we're pitting up against, like that one. We're pitting up against rapamycin.
Awesome. That should be super
which is the champion of the longevity chems compounds.
Although interesting enough, on Pump Science, Omnipal at the moment, which is a rapalog, is also is now actually king of the pill for the worms.
Oh, really?
Yeah. So it was slightly it extended lifespan slightly more than rapamycin. So that's really interesting, and it's a rapalog, right? So it came from rapamycin labs. They screened a whole bunch of dozens, hundreds of rapalog type molecules, so molecules that are similar to rapamycin, and found something that they believe is more powerful than rapamycin. So it's really interesting, and it appeared to be. I think rapamycin was like 34%. Yeah, isn't that interesting?
Yeah, it says they're at the fly stage.
They're at the fly stage, so they're hoping to get some fly data, and I think we should be able to get more fly data as all of this comes. For those that are not keeping a close eye on Pump Science, you should. The amount of data that's coming out, you can argue: is it statistically significant? Is it big enough populations? It has been running long enough. All of those things are true, but it's still signal, and there's still some signal there, which is worth paying attention to. With all of these studies that they're running, I mean, they're running, I don't know, almost 100 different molecules in different studies. Like it's wild.
Yeah, and we're still, interesting. We're
still early, right? It's still so early. Like this is what's going to accelerate longevity, right? If we really, decentralized science, ultra lean, ultra fast, on platforms like Pump Science, is going to transform things. They partnered with Aura Biomedical, which has the worm bot. They use AI to track the worms. Basically, the worms, as long as the wiggly worms are wiggling, they're alive. The moment they stop wiggling, they're dead. AI captures their movement. It's relatively simple today, but you can imagine more advanced AI algorithms running on top of that to give us even more interesting data too. So it's super interesting. Okay, so we're now, we now have these two molecules, these two peptides that are being tested in mouse models. Hopefully, in the next couple of weeks, we're going to find out how they've done in terms of cognitive enhancement and longevity. As we're kind of exploring the space further, are there other peptides you're really excited about? You think people should be aware of, should be looking into? Maybe you're exploring them with Nootropics DAO or in other ways. Is there anything you could share with us on that front?
Well, okay. I mean, peptides. Well, maybe we should talk about Cerebrolysin.
Oh, okay. So tell us about Cerebrolysin.
Do you know about this?
No.
Okay.
I wanted, okay, it's a lysin, Cerebrolysin. I can only imagine it's a lysin. So that's
the brand name, man.
Oh, that's the brand name. Okay. So what is it? I actually don't
This
know.
this is a pig brain extract,
Okay.
or what they call porcine.
Okay. Yep.
Porcine pig brain. This is the extract of pig brains.
So it's actually an extract of pig brain today. Like what you have there is a pig brain extract.
Yeah.
Wow. Okay. Well, so what do you do with pig brain extract?
Well, you inject yourself with it.
Wow. Okay. All right.
It sounds crazy, but
It sounds very crazy. So tell us why. Tell us why.
I mean, why not? No.
Yeah.
Well, so this is manufactured in Austria.
Okay.
And the main thing that it's used for is for treating stroke, traumatic brain injury, any kind of advanced cognitive decline, Alzheimer's, dementia, etc.
Huh.
This is highly effective for.
And there's strong data around that too?
There's strong data on this.
Wow.
But
okay, so yeah, but
now there is the research is kind of, there's been some controversy in the recent years because the original one of the original researchers that was running all these studies, there are claims that he basically falsified a bunch of it.
Okay.
So whether the research was legit or not, what I can tell you from people that I know who are using this on people who have had strokes, right, who are not even conscious. Mm-hmm. So,
and just to paint a picture for people who don't know anyone that's had a stroke, I mean, it is severe. Some patients are unable to move like half of their face, they slur, they can't speak correct. Like it is very severe when you have a stroke. Can't walk, can't move well, very debilitating.
Yeah, and so, but basically, so people who actually use this stuff, right? So we're talking about anecdotal reports, which is not as reliable as double-blind, placebo-controlled, randomized trials. But these are trustworthy for, in my experience. Like, I'm interested in what they call N of 1 studies, right? N of 1 is one person's experience. And this is enough for, me to experiment with it myself. And so what I can tell you, like, when I've taken a lot of things and I don't feel jack squat. But this one, I feel it.
Huh. And what do you feel?
You just start to feel this really potent head feeling. And so more focus, more calm, more clarity. This one works, and a lot of people consider this their favorite nootropic.
Fascinating.
A lot of people in this space who try everything under the sun, and this is their favorite nootropic.
And Marshall, have you tried to figure out what's the active there? Is it a peptide? Is it a small molecule? Do you know what's active there?
Yeah, so somebody has actually done some mass spectrometry and identified there's a whole bunch of different peptides in it, right? Huh. There's amino acids, but there's a whole range of peptides. So yeah, there's all kinds of stuff in there. So of course it makes sense that it would work.
I was just going to say, like, a lot of people are like, oh, gross, injecting pig brains, right? But
I was
But
there.
yeah, but the reality of it is, when you look back at the history of medicine and some of the breakthroughs in medicine, a lot of people don't realize that we used to inject insulin from pigs' pancreases and horse pancreases to save people who are diabetic. Like literally, it was a death sentence. If you became diabetic, you were going to die very, very quickly. And the abattoirs were a place where insulin was made. Basically, it was taken from the slaughterhouses. And so, medicine has a way of starting in a kind of unseemly places, and then over time saying, "Oh, actually, we now know what insulin is. We can genetically modify a bacteria or a yeast, make it, and now it's nice and clean. You don't get the massive reactions." And then it moves from there. So that's, it's one of the reasons, Marshall, why I asked you about actives, because once we start to understand what might be working, then the path is eventually we start making those peptides. We start doing that where it's not a product of a slaughterhouse, essentially.
Right. And don't they still like transplant like pig valves and stuff like that?
They do. They
like,
do.
We're still
They're pig
taking stuff out
valves.
of animals.
Yeah. And in fact, George Church and United Therapeutics are still working on things like transplantable kidneys and other organs from pigs. And so genetically modifying pigs so that they are more human-like, so that the organs can be transplanted. And there's a huge organ shortage. Obviously, the ethics of growing animals for organs is not something I'm personally excited about. I'd much rather grow it in a bioreactor. But I get where people are coming from, and so it's a pragmatic solution to a very, very big problem.
Yeah. So in my experience, this stuff works like crazy. There's now on some of these peptide sites, you'll find quote unquote cerebrolysin, and it looks like a little vial, just like how you buy the peptides from gray market peptide shops. It's a little vial, and it says cerebrolysin on it, and that is a scam.
There we go.
Is not now. It's not not the vendors themselves, because they don't know better. But like I said, real cerebrolysin comes in this glass ampule. It's a liquid. It doesn't come in a tiny little vial. Those little vials are. It's the Chinese attempted to copy cerebrolysin, and they came up with what's now called over here cerebroprotein or cerebroprotein hydrolysate.
Huh. And what is it?
It's a similar extract, but these have been tested against cerebrolysin, and in a study, and it was nowhere near as effective.
Mm-hmm.
So, but it's being touted as cerebrolysin, and that's the thing. Like, people are going to hear this, they're going to go out, they're going to try to buy it, and then they're going to get the wrong stuff.
Mm-hmm. And
which might be
Marshall,
good, because it leaves the good stuff for the rest of us.
That's a huge challenge in general, right? Like with these gray area peptides, these gray markets are like, how do you even know? Like, you get something, it's lyophilized protein, and you don't know necessarily whether it's even active. So you might be injecting yourself with something that doesn't work. Like the proteins themselves are denatured. They don't work. You denature a protein. You basically change the structure of protein. Protein doesn't work. Peptide doesn't work. And that's if you're lucky, if you have the peptide. Some of these cases, some of these products don't even have the actives that they say they have, right? So there's all sorts of confusion in this space.
Yeah. Because obviously it's not regulated. And so there's all kinds of problems with the gray market, and the better vendors will publish testing results of every batch. But some things, like they don't even understand which testing is reliable and so on. Some things, like cagrilintide is, it's an amylin analog. And if it's not formulated and reconstituted at a particular pH, it can be highly toxic. And they're using testing methods that are not able to actually tell if the peptides have been degraded. So that's one I would stay away from in the gray market. And we're planning to put out, we're putting out a bunch of like Mythbuster content, because DeSci as a whole, DeSci in general is sort of like coming for Big Pharma, right? It's like at war with Big Pharma. And so, but we're not just at war with Big Pharma, like we're also at war with mainstream biohacking.
Yep. The snake oil sellers, right? The snake oil sellers.
Yeah, exactly. Or even just the gray market, just like unsavory, questionable safety practices and so on. So we're going to be, and this is a great example of like a myth we'd like to bust, is what the real cerebrolysin is. Mm-hmm. And, and then we're also going to talk about, our first release from our knowledge factory is going to be about mitochondrial optimization.
Amazing.
Because, people think about nootropics and they think about like smart drugs, but no nootropic is going to do anything for you if you are suffering from mitochondrial dysfunction. Mm-hmm. Because people come to nootropics for all kinds of different reasons. Some are trying to get the edge. They're trying to perform better in school or at work or in their career. But a lot of people are just trying to like recover from some kind of cognitive decline or brain fog or long COVID or, any kind of thing like that. Or just like, cognitive decline from aging. And so our first release is going to be focused on mitochondrial optimization. And we are going to do some myth busting there and talk about the kinds of interventions that we like and the kind of interventions that are mostly snake oil. And a great example of that, one of those is methylene blue.
Huh. Okay. And by the way, I don't know if you saw that there was today, new results were just released for methylene blue and its effect on lifespan. So this is going to be very interesting, by the way, because I know we've talked about methylene blue. So share your thoughts on that. And I don't know if you want me to tell you before or after you do what the results were for methylene blue.
Well, so it can function as an antioxidant, and so it could be helpful for extending lifespan, but as far as mitochondrial optimization in particular, it's mostly only effective when you have a particular mitochondrial dysfunction.
Interesting.
Not general, but a particular kind of mitochondrial dysfunction. So if your average person, because this is often touted as a nootropic,
Yes, it is. I know plenty of people who biohack themselves with methylene blue. Yeah.
Right. And the thing is about it, it's like to get the effect out of it, you've got to be dosing it within a very particular range. You sort of have to find the sweet spot. Like too little does nothing, too much is actually harmful. So you got to find the sweet spot. And like I said, I mean, the people in terms of mitochondria, like the people that are going to get the main people that are going to get benefit from it will have a particular dysfunction, which we're going to talk about.
Okay, great. Would love that. I know we're coming close to time, but would love to. What's the particular dysfunction that people on methylene blue?
It's with one of the complexes of the electron transport chain.
Fascinating.
So, we're getting kind of technical now.
Yeah.
But
and how does it present, this dysfunction? How does it present? So because usually that comes with a name, right? Like the disorder, dysfunction comes with a name. A lot of people who might be watching might not be aware of what that dysfunction is, or if they even have dysfunction. Because I think there have been recently a couple of papers that have just been published around mitochondrial dysfunction and things like schizophrenia, bipolar, like very serious illnesses that actually could be mitochondrial issues versus just neuronal issues.
Yeah. That's totally accurate because the mitochondria are in all the neurons.
And the neurons need power. And if the power is not quite right, you're not getting enough power, that can cause dysfunction.
Right, exactly. So what the methylene blue, so there's this electron transport chain. And basically it's passing electrons between all these different complexes, complex 1, 2, 3, 4, and is there 5?
That's a level of detail I cannot remember, I have to admit.
Right, that's ATP synthase is complex 5, and ATP synthase is like this turbine that's like constantly spinning, and it's like pumping electrons into the mitochondria and pumping ATP out. It's pretty cool.
It's exquisitely complex. Like for those that have not looked into the mitochondria, it is exquisitely complex. It's well worth its own hours of conversation around the mitochondria.
Yeah, I mean, we're going to have it's looking to be like a 10-part series on mitochondria.
It's a fascinating powerhouse. Okay, so kind of pulling all of these things together. So nootropics are fascinating. Peptides are fascinating. The frontier is fascinating. What would you say to people that want to get involved, with Nootropics DAO or learn more about peptides or some of the other things you've mentioned? What should they do?
Well, you can go to our website. It's nootropicsdao.com. And I think you can subscribe and join our email list. And so you can get updates there. You can also follow us on Twitter/X.
And we can join the Discord as well. Join the Discord.
We do have a Discord. But right now we are basically transitioning to our platform.
Got it.
So
okay. In progress. The platform is in progress.
Right. The platform is in progress. And so we're currently doing some private testing. But and we have a token launch. It's supposed to be in the fourth quarter.
Awesome.
Still. So I guess that's going to be in the next couple months.
Soon. Yeah. In the next couple weeks.
Yeah.
Okay. All right. Well, keep an eye out for the token launch for the website, the x.com. And then, Marshall, thank you so much for taking us on a journey through the frontier of not just nootropics, but peptides themselves. And even further down, to the cerebrolysin. It was totally new to me. So really appreciate the insights and the conversation. Can't wait. I'm sure we're going to have another one of these conversations. Can't wait to see what interesting work you and the Nootropics DAO team end up doing and launching, and what new products we explore. So looking forward to our next conversations, and I will be following as things evolve. Thanks, Marshall. Appreciate you.
Yeah.